folks, this is Hariom for CBNR. Today we are going to talk about pain and imaging rather than specific condition, mostly what happens with pain and imaging. What I mean by imaging is X-ray and MRI and CT scan, all the other things, right? Now, if you want to understand pain and imaging, the first thing you want to understand is what is pain. And if you see the definition, you will see two parts of it. One is the sensory part, another one is the emotional part of it. Even though it has a sensory experience, it also has a large emotional experience, right? So what I mean by emotion is, if you ask somebody, "You're happy, right?" Or you're happy, then they will. You have to ask them to find the answer. You can't see them and uh, see their faces and find out whether they are happy or sad, right? You have to ask them to find out. Likewise, you can't see pain by definition. It is difficult. It is not possible for you to see pain because it has an emotional experience, right? Like in case of headache, if you tell somebody you have headache, then only I will know you have headache. If you are a child, the common way to skip school is say that I have stomach pain. How will anybody know whether it is true or false stomach pain, right? So that is the first thing for us to remember. Now, when we are talking about imaging, what imaging does is it takes a picture of insides and outsides of your body, and it gives you it shows you something. And remember, that's not showing you pain, that is showing you some pathology inside or some changes inside, and you need an expert to tell you that that change is actually what is causing you pain. I'll just give you some examples. If you have a particular type of pain and in your stomach and it is very painful, then you may say that you may get a ultrasound and find out there is change in your appendix, or if you had a fall and you may have a separation of two structures like a fracture, or there is some infection and you may get these kind of changes in your MRI. All these things can be seen, and somebody has to correlate that this is what is causing you pain or this is a pathology, right? Now, this is what these two conditions where you have fracture and pod spine of your lumbar region, that's what we call a specific pain. That is, we know a specific reason for your pain. But remember, most of the time, it is difficult for us to correlate between the findings and your pain, especially in case of OA knee or pain in your knee, neck pain, low back pain, probably a lot of shoulder conditions, lot of places you cannot correlate, and you also don't need to correlate also. That is slightly technical. I have done that in another video. We can look into it. Now, if you want to have a X-ray for these conditions, what you will see is that there is a reduction in joint space, there are bone spurs, narrowing of the spaces, the joint bulges, disc is bulging. All these things you can see. Remember, as I told you, anybody can see these things. Seeing is not an MRI is for. The MRI is to find out, or anybody is looking at an MRI or an X-ray or trying to correlate what they are finding and whether that causes you pain. And what we have found out is like thinning of your hair, change in your skin as you grow older, losing of your color in your hair, or your heart getting weaker. All these things are part and parcel of you getting older, all organs undergo changes. So whatever most of our imaging captures is just part and parcel of naturally things happening to you. And it is difficult to correlate that between what you see in the imaging and what your pain, right? Our pain in our patient also. So it's a poor indicator between all these things. So how do I know that you have pain, or how will any therapist or a physician or surgeon know you have pain? Is you have to listen to your patient. So for that, your patient has to give you enormous amount of information. For that, you need to listen and ask the right questions. That's what we call it as a consult or history taking. And from that also you will get a lot of information about whether this patient needs an x-ray or an imaging or things like that. If you go, as I told you, if you go to with stomach pain or headache, nobody gets an x-ray or an MRI, because from the history we know that whether you will need it or not. Likewise, if you have a huge fall, or you had a tremendous fall, or you had lots of fever and it is not relenting and you have back pain, probably these are the conditions where they will ask you to get an x-ray or a MRI to find out, or to rule out specific pathology or dangerous pathology, however you want to name them, right? That is what an x-ray or an MRI does, not find out your find out where you're having pain and why you are having pain. So I just want to finish by reiterating that if you assume that the patient has serious pathology, then try to send them for a referral for an imaging or things like that, not as a routine for everybody. History taking and listening to your patient is the far more or the most important thing for you to do in case of a patient with pain, right? So leave the MRI and X-ray alone. Listen to your patient and have happy patients and good outcomes in your practice. Thank you. Bye-bye.